There are some common lab tests that are done for platelets to assess if they are within normal levels and working properly in the body. The first lab test we will talk about is the platelet count, which measures the number of platelets in a microliter of blood. A normal platelet count should be between 150,000 and 450,000 platelets per microliter. This test provides a basic assessment of platelet levels and helps determine if they are within the expected range for normal blood function. Since platelets play a key role in clotting, this measurement gives insight into the body's ability to maintain hemostasis and its ability to clot properly. The closure time test, also known as the PFA 100, measures how long it takes for platelets to form a plug in a simulated blood vessel under controlled conditions. This test mimics the natural process of hemostasis by exposing platelets to a membrane coated with collagen and other activating agents, such as epinephrine or ADP, to simulate an injury. An instrument records the time it takes for a platelet plug to close an opening, providing insight into platelet function and their ability to respond to vascular injury. This test is often used to evaluate how efficiently platelets contribute to clot formation in a controlled setting. Normal values for the closure time test vary based on the specific reagents used in the test. The two most common testing conditions are collagen epinephrine, less than 180 seconds, or if using collagen ADP, less than 120 seconds. A PT-INR is a test that doesn't test the platelets directly, but looks rather at the coagulation cascade and how well it is functioning. PT stands for prothrombin time, measures how long it takes for blood to clot by evaluating the extrinsic and common pathways of coagulation. INR stands for International Normalized Ratio and standardizes PT results to account for variations in testing methods, making it easier to compare results across different labs. Normal values for a PT are between 11 and 13.5 seconds. This varies slightly by lab. Normal values for INR are between 0.8 and 1.1. Let's take a look at some variations to the INR value. If the INR is less than 0.8, blood may clot too easily. If it is from 0.8 to 1.1, it is considered in the normal range. If the INR is between 2.0 and 3.0, this is a therapeutic range for patients on warfarin, Coumadin, to prevent blood clots. If the INR is greater than 4.0, there is an increased risk of bleeding. Knowing your normal lab values help you to determine if your patient's platelets are working optimally.